Let's go ahead. We've got a lot of wonderful information to share today. So today is our part two of our Talks on Tuesday series titled Safe and Supported, Preventing Suspension and Expulsion in Early Childhood. And we have a really phenomenal group of folks here who are very dedicated to this mission and have put a lot of work into developing a toolkit for different stakeholders who could play a hand in helping a young child with a disability or who has some developmental delays be in a childcare setting, included and happy and supported in that setting. So we're going to go ahead and jump in. Before we do, Seth Bufkin is going to talk with you about some Zoom accessibility tips.
Hey guys, yeah, I just want to make sure that everyone knows that there are several things you can do on Zoom to make sure that this webinar is the most accessible to you. And there are auto-generated captions, which you can select at the bottom of the Zoom menu. There's keyboard shortcuts that let you operate the entire Zoom meeting without even having to touch your mouse. And then there's screen readers on Zoom, and you can check both those things in the Zoom settings. And as always, you can send me a private chat in Zoom if you have any questions about this.
Exactly. Seth will be monitoring to see if anyone has any tech questions, related questions. And then one of the things we like to do at the beginning of all of our webinars is really help ground everyone in kind of why we're here, what competencies we as early interventionists or those in the field are really honing through these professional development opportunities. So one set of these are the Division for Early Childhood's recommended practices that really guide everything that we do with young children and families. Today's webinar focuses in on the family practices strand, and those are really looking at that that family provider practitioner partnership. And then we also know and like to honor all of the service coordinators that are here with us as well. And the knowledge and skills for service coordination really are the backbone for service coordination practices. And again, the focus there for today is on family-centered practices. So there's some information here if you'd like to read it. But I'm going to go ahead now and turn our webinar over to our presenters today. And we're going to start with Lisa. Terry, if you'd like to go ahead and introduce yourself and then tag a colleague.
Sure. Hi, welcome. My name's Lisa Terry. I'm an early intervention professional development consultant with our VEIPD, which is Virginia's Early Intervention Professional Development Center here. And I've been doing this training for early interventionists in Virginia for about 8 years now almost. And so I'm really excited to be here with you today. I also have experience as a service coordinator and an educator, and I still actually go out and see some families too. So I've got to work closely with families and childcare and give them that support. I do want to say that I wish our colleague Tracy could also be here today, but she will not, but she did a lot of work with us throughout this process. And so I did want to go ahead and acknowledge her as well. And I'm going to go ahead and pass it on to Amy.
Hello, my name is Amy Sheldon, and I'm one of the program managers for the Early Intervention Program of Loudoun County. Previously, I've worked as an early childhood mental health consultant and with other ITC systems and child find systems, and have had a lot of experiences with the preschool expulsion and suspension dynamic. And so I'm excited that this work is out there. I'm going to pass it to Heather.
Hi, everyone. I'm Heather Tavares. I am also a program manager with the Infant Toddler Connection of Loudoun County. I am an occupational therapist by trade and also have acted as a service coordinator. I've been in Loudoun County now for 15 years. And prior to that, I was in a private practice, pediatric setting, also doing contract work with early intervention in both Fairfax and Prince William County and some DC schools. So have kind of had the range of pediatric experience, and also I'm just excited to share what we've put together for everyone. And Joanna.
Hi, everyone. I'm Joanna Van Doren Jackson. I'm an assistant director with Loudoun County's Department of Mental Health, Substance Abuse, and Developmental Services, and I oversee residential services for adults employment and day services for adults, coordination services for children and adults, and early intervention for children and families. I have a long history in EI. I have worked in 3 different states in EI as a speech language pathologist and a service coordinator. I am endorsed with the Infant Mental Health System of endorsement, and preschool expulsion is very near and dear to my heart. I have been working on this and concerned about this for probably 8 to 10 years. Back when I first began learning about the preschool to prison pipeline. And as it seemed like it was becoming more and more of an issue in Loudoun, I feel very fortunate that Lisa Terry and Tracy and Heather and I were able to work together to develop the materials that you'll learn about today. So a big thank you to this group for the work.
Yes, thank you, Joanna. So let's get started. So just a quick recap for those that were not able to join us for part 1, which is archived, and you can still access the video recording if you'd like to, but I just want to kind of quickly go over some things in case you did miss it. We did share some stats, including this one, that preschoolers are expelled at a rate that's 3 times higher than children in K through 12 schools. And this is just what is reported. Often, a lot of times, suspension and expulsion actually goes underreported for young children, especially in that early learning centers across, well, really nationwide. And I think you'll see, like we shared a lot of like news articles that kind of like even showcase that too. It's really been something that's alarming nationwide for us. And so we also discussed what the impact was on the child as well as the family, really considering the mental and the physical health on the child, that increased anxiety, depression, behavioral disorders, those feelings of rejection, that stigma, and that stress, right? And we all know what stress can do to our bodies. And so really thinking about those long-term impacts as well, including the likelihood of academic failure, grade retention, and eventually school dropout, right? And so that was really concerning to us. And this is why we really feel the need to address that. And then when you think about that impact on the family, you think about the financial impact, right? Like they are potentially losing access to an affordable childcare. It can also be something if they get a phone call and the school's like, hey, like you got to come pick your child up, they could have missed work, which could be a loss, especially if they were relying on that for their financial income. And so they also could potentially lose their job. And so that financial impact is huge on a family, as well as that stress and that emotional strain, right? Families, again, might be worried about getting that phone call, right? Like every day, like, is the school going to call me? Or are they going to tell me to come pick my child up? And then they can also have those feelings, where they might feel stigmatized or they might feel blame, right, for their child's behavior or what's going on. And as we all know, stress can impact the whole well-being of that whole family unit, right? So families, they can face a lot of the access and understanding challenges. There's significant wait lists, especially on recommended childcares. There could be unexpected childcares closing too, like that's happening in my area right now, where 100 families are losing access to a childcare center, and now they're searching for it. There could be limited understanding about what is developmentally appropriate for child development, right? And so it's really important to understand how that impacts the child and the family, because those are really big factors to consider. And we also shared the impact on the childcare themselves, right? And it's really important to think about this because they could have limited staffing, higher turnover rates, they can have limited access to training, or not really understand what child development is appropriate for that child's age. And their options might be limited, right, to any kind of resource support that might be available to them. So it's really important to understand everyone's perspective. And also, we were so excited to premiere this new video. We have a series called Heartwired, and it focuses on the social emotional well-being of all families. And we shared one perspective from this family. And so definitely you want to check that out if you missed that. And Lorelei will drop the link in for you in the chat. So let's just talk quickly. Seth is going to pull up a poll, and we would like to know, how confident do you feel in your ability to prevent suspension and expulsion in early childhood settings? Confident do you feel right now? We'll give you a little bit to get that completed. Thank you, everyone that's participating in the poll. I see it moving. We'll share those results briefly. All right. Looks like it's starting to slow down. So let's go ahead and share those results, Seth. All right, so we have about 2% that feel very confident. We have 33% feel somewhat confident, 24% feel neutral, 26% feel slightly unsure, and then 15% feel not confident at all. And hopefully what we're going to do is we're going to show you some tools and resources that we developed today, and that will help boost your confidence a little bit more in really addressing this. Thank you, Seth, for pulling that up. And so we just wanted to kind of start in the beginning with this shared commitment, right? Every child deserves a chance to flourish. So let's stand united to eliminate suspensions and expulsions in early childhood. Let's create those nurturing environments where all children, they can grow and succeed. And together, this is something that we can build inclusive early learning opportunities and communities that support every child's potential, replacing that exclusion with understanding and opportunity. So let's stand united, which is the title of our campaign. So speaking of our campaign, as Joanna shared with you, they originally had approached us because they started to notice this increase in suspension and expulsion. They approached Tracy and myself, and we met with them. We were like, okay, so what can we do, right, to help address this issue? So we came up with this idea to develop this information package, and it's called Standing United, Preventing Suspension and Expulsion in Early Childhood. And we considered this information and who needs this information, right? Who can we provide this information to? Who needs to know a little bit more about this so we can create this awareness? And together, what we did was we developed materials for specific audiences. So for early interventionists, for families, for early childhood leaders and educators, and for pediatricians. And together, that's really where we are standing united, and we hope that you do too. So Heather is going to get us started and start sharing information about the 4 early interventionists.
Thank you. So we're going to start by talking about early interventionists, us as providers. And I think we all know our dedication is to serve children in their least restrictive environment where they normally are. And for a lot of children, that is at preschool or daycare. And we know, as Lisa kind of summarized, that the challenges that those daycares, both as wholes and as individual teachers, can face. So we're really wanted to focus here on what we can do as early interventionists to support families. So the first thing is really looking at maximizing our coaching partnership. We want to make sure that as a provider, we're taking the opportunity to connect not only with those daycare teachers, and although they are really important, but also, expanding your outreach when you're in the daycare centers or preschools to looking at the administration team, and any other providers who may be coming in and out of that classroom during the day, I think is also another really important perspective. You may be there every week or every couple of weeks at 9 a.m., but who's seeing that child at 12 and at 2 and at 4? So just really looking at the people that are part of that team and that partnership with us. And then also thinking about providing those centers with opportunities for professional development. So outside of your sessions in with the children that you're serving is looking at, can we provide, like a Talks on Tuesday, but a lunch and learn, something like that for those providers. And also delving into the partnership of your own organization. So, I'm an OT, but I may look towards my developmental specialists or speech therapists or the social workers I work with to help do some of those sessions and provide some training for all of those caregivers. And with that said, that is a way to utilize your peers. So not only to help with some of those trainings, but also to team these difficult situations in daycares to provide time to reflect, get their perspective and their experience on how they've handled similar situations in the same setting, like specific daycare center or preschool, but also just in general. And I think teaming is such an important part of early intervention. And because we're out on our own all the time, we can forget that we really have a wonderful team around us. And then we really want to talk about us being practitioners as advocates. So we are both an advocate and representative for the families when we are seeing them and communicating in childcare centers. Families can definitely ask us to participate in those meetings that they may be having with the teachers or administrators when issues arise. And that we really are looking at what our goal is to make that child successful, right? Everyone in those meetings wants that child to be successful. And so in the handout specifically, there are specific questions that we developed to kind of help guide if you're not sure where to start. But asking, what part of the day goes well when she's here? What part of the day is a challenge? Are there specific situations or specific times of the day? Finding out, if anyone has some insight into what's kind of contributing to that difficulty. What new approaches can we do? And then how can my role as a provider best support this team as a whole so that child can be successful in that daycare or preschool setting? And then lastly, that we can really support with resources so that I am a resource. We are all resources, but then external resources. So we do have some listed in our handout for ER providers about childcare resources and referrals, also known as like a childcare assistance, Easter seals, the ARC are some of them. I think sometimes families will have to explore a different setting for their children, that it may just end up that the one that they are in is not the best place to support the child that we're seeing in that family, so that we can provide resources on how to find other alternatives in our communities for families is really important. So our handout also has some of the more general statewide resources. And then I think we would all encourage you to develop them for your local community and area also. So what we're actually going to move into next is a little case study of Olivia. And so Olivia is 19 months old and has been attending childcare part-time for the past 2 months. During your last home visit, her mother, Carol, shared her frustrations. Olivia was suspended from the program after an incident where she reportedly hit and bit another child. Carol explained that Olivia communicates using about 3 words, often explores her environment by mouthing objects, and enjoys active play. She generally struggles with sitting still for extended periods. So our question for all of you and to participate in the chat is, what do you think your next step as an early interventionist supporting Olivia and her family would be? So we're really just looking for some beginning ideas here where you guys would start with this family. So I'll give everybody a minute or so, a few moments to type some things that you can think of where you would start. Yeah, I think, so Beth said, what has mom done already? I think finding out, if she's reached out, who she's talked to, what information she's gotten. Yeah, also finding out what her interests are, what Olivia's interests are. Emily, yes, asking about what happened before the biting and hitting happened. So can they find out if there were some precursors and things kind of happening, finding out if there's a diagnosis. And yes, Jennifer, if this is her first incident, I think finding out what the daycare's policy is for if she got kicked out because this was the first time, or is this something that's been happening? Ashley says to talk to daycare and become familiar with routines and expectations, the physical environment, how Olivia does in general at daycare. Casey, yes, finding out if there's other children hitting and biting. Is this something that's going on with others? Martha says previous documentation and conferencing with the parent should be considered. And also observing and inquiring what times of the day these behaviors are happening. Are there triggers present? When things have they tried? All of those I think are great. I think one of my thoughts too, would be to see if maybe an appointment at the daycare center or childcare center would be appropriate for when she returns. And yeah, what environment they were in, or routine. Bhumika, thank you. Juliana, what are the teachers doing before and after? And asking the family about schedules and interests. I think those are all really great things, kind of trying to dig into the whys of what happened, both before it happened, after it happened, what they're doing. And again, finding out if this was a first-time incident or if it's been happening frequently. I think those are all really great things. And I think, and Jennifer, meeting with the teachers and director to discuss the big picture, to partner with them to create a plan. I think, yes, that's really wonderful. I think that we can help that family start to advocate for their child and have those conversations with the daycare center, and how we can bring our expertise in to help kind of do that environmental kind of look at and breakdown for what happened. Those are all really wonderful.
You know, Heather, what I like about all these suggestions are they're really showing a lot of curiosity, a lot of interest in what was happening around her. It wasn't just something Olivia did. It was, what is the big picture? What are the components? And I think that EI is, our providers are really good at asking those questions and thinking about environment. And sometimes the school staff are really busy, and they're just really thinking about what happened, what am I going to do, what's next. So it brings that different perspective.
Absolutely. Thank you.
Yeah, and what I like too is I know some of these people responding were also former center directors themselves. And we know early childhood can be a small environment within our realm. And it's nice to be able to kind of pass this on and, like, as we've developed, stand united and kind of get everybody on the same page too. I am gonna take it to talking about families. So we do have a handout specifically for families. What I think happens is, if you as a caregiver or parent experience this, it feels like it's a lot of happening at you, and that there's not a lot you can do in the moment. And I think what I like about some of the suggestions here with the handout is we want to kind of empower parents to be proactive kind of in the beginning, and then also help them through what happens afterwards should this occur. And so they're the biggest advocates for their kiddos, but also a big thing is we want to encourage families to go ahead and start that partnership, and that it's okay for them to kind of lead that discussion as well. And I think come to an understanding where it's not just parent and then teacher, it's really, we have two caregivers for this child who are both equally invested in the well-being of the child, and to kind of frame it and approach it in that regard as a partnership too. And so we can kind of start that conversation even and guide how, the strategies and discussion should go, just like even if they've had a tough day, you're bringing your kiddo in, they've had a tough day that morning, communicating with that teacher and saying, it was really rough. They've had a rocky night of sleep, but they've had some time to just kind of cuddle with their teddy bear. That seems to have worked really well. I brought it just in case. If this is something they might need kind of a little break later too, to kind of get to that strategizing with each other. And so just like in the previous one, talking about what goes well, what doesn't, kind of having that discussion and being okay to kind of initiate that and explore that with the teacher, to have that partnership mindset. Also, becoming familiar with developmental resources. Sometimes it's helpful to know where your child might need more support with, just developmentally, and just being able to check in, just kind of as a grounding area. And so there are a couple websites like Pathways or the CDC developmental milestones we've listed. You might have some as well, just to kind of check in, see how things are going, and see if there's areas you might want to explore further information or support in, or just kind of generally check in to see developmentally what's going on. Things to consider when choosing childcare for your child. I think a big thing is sometimes it's a matter of, I just have to kind of find a place that we can afford, that's close by, that I feel comfortable with. I think what's helpful with families too is to tease out, what does that mean as far as that comfort, when we're trying to kind of list it out. Let's talk and reflect about what's important to you, and taking that time to kind of tease through that, I think, is really helpful, so that they feel more prepared when they're exploring different childcare options. And so even if you're looking just kind of for a place to start, there is some links to the Virginia Quality Birth to 5 measurement too, where they give you information. Any preschool or school childcare program that receives any kind of federal funding does have to go through specific measures and observations, and you can get information on how that school did. They do it annually through that site. Also, just knowing kind of what questions to ask, like with I'm sorry, that's this part. With the child care center, as far as, is it really important for you to have a specific social emotional curriculum? I think especially in specific areas, there's such an emphasis on that reading and writing, and to kind of know here developmentally, we're really looking for that attachment, the social supports, and kind of exploring different emotions and identification, and how much is that part of the curriculum, and what else are you doing, and what's your philosophy on suspension and expulsion, getting that ahead of time, understanding how do you support children who might have delays or disabilities, what's already incorporated there, and again, just kind of being able to tease that out with families a little more. And then accessing community supports and resources. A big help is within the state of Virginia, they do have funding for parent resource centers through school districts, and some of them are also identified as family resource centers. These are a great place to get free webinars, free consultation, information on different books you can check out. And there's a lot of information on the special education process with them as well. And then also knowing your rights. And so I know it's difficult sometimes for privately funded institutions where it is a little more on their own regulations versus some federally funded places. But to still understand, if you feel like you've been discriminated against, you can make a report. And there are county regulations, state regulations, and this is the information you can find on that. And kind of getting a sense of what you're able to access, what you should be looking for, and who can help you advocate. And I think some of the resources available can help you walk you through that, especially like the Parent Resource Center, and then also PETSI, the Parent Educational Advocacy Training Center. And then knowing what to do once an expulsion or suspension has occurred. And so this is, again, helping to access resources. A lot of the times it's just, where do I start? Part of it is if they're already connected to ITC through you, if you are connected that way, or just understanding there are additional resources such as the infant toddler connection and the child find, but also play-based therapies, and understanding why that's more appropriate versus the talk therapies or the dyadic therapy. Child care resource and referral as well, to just kind of have a sense of where do I even start if I'm looking for something more specific to maybe a home-based center, or somebody that will accept my subsidies. So just kind of giving them more information to kind of empower their next steps. Okay, so in the handout, we're reviewing the handout with the family, with Carol specifically, Olivia's mother. Carol expresses a desire to better understand the child care program's suspension and expulsion policies. However, she isn't sure what questions she should ask or how to start the conversation with the staff. How do you support Carol in advocating for Olivia in this situation? Or if you've been in this situation, how did you start that conversation with that family? And as you have a moment to think and you want to pop that in the chat, I think a big piece is just helping the family understand that they do have a voice in this and that they can advocate for themselves and pass on information. Because again, I do think sometimes it's just not knowing what to be able to ask or to be able to ask for. Beth, yes, role playing it out. I think sometimes that scary part is that unknown. So to be able to kind of work through what that might look like is really helpful. Anything else?
Amy, I will jump into and share like one thing like I've done is really offered to help attend the meeting and schedule that so we can help provide that support. And that was like as my role as a service coordinator before and really being there. And I think that kind of helped the parent just feel a little bit more confident and using her voice a little bit too, you know, just having that person as your support system.
No, and I think that's helpful too in being as available as needed too, and just kind of if you want to be there as a support or do you want to help kind of start the conversation and guide it. Possibly scheduling meeting with admin and parent. Yep. Just and be there as a support. Perfect. That's like we was saying. Oh, and then Jennifer encouraging setting up a phone call or meeting. Yep. All in that same vein. Perfect. And then I am going to go ahead and hand it over to Joanna to talk about early childhood educators.
So we developed some materials for the early childhood educators and leaders. And Heather and Amy have talked with you about more familiar roles in EI, where we have conversations with families and we talk to them about supporting their child's activities. But our conversations with the daycare administrators or the daycare teachers hasn't been quite as much of familiar territory. And so this may be a little bit new to some of you. So when we developed the materials, I'd like you to, when you have a chance to take a look at them, but also thinking this morning about what questions you might have in your head or things that you would want to know as you approach this daycare or childcare setting with the family. Childcare for the leaders, it's really important, and we included this in our handout with them, the research that's related to childhood or preschool expulsion. Many times the child care administrators are very active, very busy. They may have come from a different background and may not be as familiar with the research. So we included information on about the critical period in a child's development, that there's a loss of educational support when a child is expelled, and that can hinder their child's developmental opportunities. There's a higher risk of negative outcomes. Children expelled from preschool or childcare are 10 times more likely to drop out of high school or experience academic failure. And the preschool director may not be aware of that, may not have learned that or thought about that. They may be thinking about hanging on to their teachers and not losing their teachers, and not necessarily realize that the parent may lose their income or experience financial stress. So what can, we included information on why it's important that preschool expulsion not happen so quickly, that strategies are explored in advance of making that decision. They're also included in our handouts guidelines on what they can do as an administrator. And I think for those of you who are EI providers going in, I think one of the things that you can think about is, what is this school's philosophy around expulsion? Amy mentioned this earlier. And expulsion generally was in education was established as a consequence that a young person could think about and be aware would happen to them, and would guide their decisions about their behaviors. And the younger the child, the less likely the child has the developmental capacity to do that. And the more we realize that expulsion is an adult action, and it's what the adults are doing rather than anything the child has control over. So it's important for you to think about, what is this educator's or this director's philosophy about it, and why are they coming to a decision about expulsion? And if you can understand a little bit about their why, you can help tailor your approach to them. And you can have conversations with them about what they may be able to do around preschool expulsion. So they can establish clear policies around it. And hopefully that why is helps inform their policies. They can develop documentation and tracking systems. And the nice thing about that is that it makes it a little bit more objective, and it's less in the moment. Many times children get suspended when somebody's really frustrated or somebody's frightened. And when schools and daycares have documentation and tracking systems, they're taking out a little bit of the emotion, and they're looking at actually what is happening before and after. They can also provide ongoing training and professional development. And if you as a practitioner hear that they might want some training and professional development, you can bring that back to your local EI system to see if there's capacity in your system to offer some of that for them. They can collaborate with experts and provide support services. They can enhance program conditions, and they can build strong relationships. And I don't want us to lose sight of the building strong relationships in families, because one of the key pieces in the research and the evidence is that children whose parent has a good relationship with the teacher rarely get suspended or expelled. If the relationship is strong and there's a capacity in the parent and a capacity in the center to develop that relationship, they're less likely to move to suspension or expulsion. And so we want to support them building their strong relationships. We want to avoid coming in saying, well, you're not doing it right, you can do this better, I know better, listen to me. We want to come in from the approach of, both of these people want to and entities want to support a young child. How can I help support that relationship? So moving on to another scenario about the child care administrator, and going back to Olivia. You attend a meeting with Carol, Olivia's mom, and the early childhood director, Ms. Jones, at Olivia's school. During the meeting, Ms. Jones explains that the program follows a 3 strikes policy regarding hitting and biting behaviors. What would be your next steps? And what would be your next thoughts about how you might approach this when you hear that they follow a 3-strike policy?
Joanna, my initial thought all the time, especially for this age, like we have to remember that Olivia's 19 months old. And I'm like, that's hard because that's technically considered developmentally appropriate still at this age. And there's a 3-strike policy for something that's considered developmentally appropriate. So I feel like that's a hard one when I hear that.
Yeah, I think that's a really good point, and it's possibly you could say, well, is this across all ages? Do you vary it a little bit for the infant rooms? What do you do for those toddler rooms to help break down the developmental impact for the child care director without coming right to them and saying, well, that's not right. This is developmentally appropriate. You need to change your policy. Some questions to help them think about how are they individualizing it in general. And I see Gisela is saying, ask about individualized instruction. Are there informal assessments, anecdotal notes, practices in place to find out the child's style, strengths? What have we learned from the past experience? Applying the same strategies that may not necessarily be working for the family. Giselle, I really like how you're individualizing it. They have a broad policy and you're helping it bring down to this individual child. And Emily posts, hopefully the parents were aware of the first 2 incidents, but I would want to know how the situations were handled and what options were offered for the child. Absolutely, Emily, okay, what does that look like? Tell me a little bit about your process. I hear that you've got 3 strikes and that you like to be really clear with families, but what does that look like with your implementation? And Jennifer says, I would dive into details with curiosity and ask if there are things that will allow the team to help guide the child into healthier behavior. I love that, Jennifer. You're like, okay, how can we help the teacher as well? Because it is a reflection on the teacher too, if she has a child who's expelled. Morgan says, I agree. I like the mentions of individualizations and how the parents are being made aware. And Maria says, reflecting on the history and what the child had been thriving. So maybe what it was like when the child was doing well, and some curiosity about how this has been addressed with children and families in the past. And clarify, Bhumika says, clarify and acknowledge the developmental stage, their language, or what plans they have in place, or collaboration to create an individual plan. I love that. I love that, Bhumika, because you're basically saying, okay, so let's figure out a way to walk this individual and create a plan and map it to your center's policies and procedures. That's wonderful. And those are things that we need to think about, because the centers and teachers really like it when it's predictable, and families like it when it's predictable. And so when we talk about individualization, people start to get anxious and they say, well, if I make an exception for them, then I'm making an exception for everybody and I can't stick to my original plan. But when you bring it back and you talk about your collaboration to bring this child step by step to the plan, then you're allowing them, you are creating that respect of, okay, I understand you've got to have policy and procedure and you train on that. And then how do we implement it with the child? Love the thinking that's going on with that. Thank you. So moving on, we also created a handout for early childhood educators, those teachers who are there in the room all day long with the children, who get to know them, who have their relationships, but also live with that daily stress of caring for very young children and their needs. So when we think about the information for early childhood educators, we want to help them understand child development and behavior. We want to have a holistic approach. We want to strengthen the responsive care. So we want to make that teacher feel really good about their teaching and really good about their connections with the child. Have a chance to wonder, why did that happen? I noticed that. What could I do with that? And that leads to them supporting the children. It leads to the relational impact on the child's motivation to learn and the importance of communicating with the parents. You know, the teacher may feel like my job is right here in the classroom, taking care of the children, getting these activities done, making it through all the centers, getting them outside, and they're not really stepping back to realize, and I have another part of my job, which is to communicate with the families and to build a relationship with them. We also included information for the early childhood educators on when to refer and what to know to refer. And just as kind of a high level cap on that or overview of that, what we really want early childhood educators to know is looking for change. The thing about young children in these centers is that they should be changing constantly. So if they don't see change, or if they see a child kind of stuck, that's when they would make referrals. But the handout has more information about behaviors, about developmental delays, social emotional difficulties, as well as how to collaborate. So moving on to our next scenario. As part of the follow-up plan developed during the meeting with Ms. Jones and Carol, you begin providing support in Olivia's classroom. During your first session, Olivia's teacher, Ms. Sammy, shares her concerns. Olivia constantly runs around the room, has frequent tantrums, mouths objects, and hits when frustrated. During your observation, Ms. Sammy was reading The Cat in the Hat during story time. Olivia, who is 19 months old, showed little interest in the activity and began pulling toys off the shelf. What do you do next? So we're looking for you to fill in the chat on what you might do next when you see this going on in your first session visiting Olivia's classroom. And I don't know if my chat has frozen.
Probably just takes a minute, Joanna, but I just wanted to, while they're typing, let me just point out too, for the childcare educators, we really wanted to be intentional about putting a lot of more information in there, because when we looked at the research and we talked about the impact from that teacher perspective, and they really didn't have a lot of educational opportunities. So we really were intentional about the information that we were putting in there, specifically about child development and behaviors too. So it's definitely important to take a look at. And I think, like, even looking at this scenario, Joanna, I'm like, oh, The Cat in the Hat, such a long book. It's not really filled with pictures that's going to captivate a 19-month-old's attention, right? So like thinking about like what to do.
So Beth is asking, what has the teacher tried? That's a great question. That always opens it up to what is your story? What has worked or not worked? And a good question, how many adults are in the classroom, right? Is that teacher by herself trying to read a long book while she has 10, 12 children in there? Gisela says, looking at providing accommodations, activity options for Olivia that may allow for more physical activity. Yes, Gisela. I think even reflecting back to the teacher about when Olivia is moving around the room, when is that happening? Some alternatives for where she might sit. If getting her to just come over and sit near the teacher, or even looking at, so what are your expectations? Do you want the kids to be sitting down when you're reading, or are you okay if some of them stand? What does that look like for you?
I was just going to add too that I would ask if this ever goes well. Like, are there books that she is interested in, or is she interested when there's music going, or when they have when she's passing the Cat in the Hat doll stuffy around, or do you know what I mean? Like, I think also switching it to find out and looking strengths wise, like, when does this go well? When has this gone well? Do you know what I mean? Kind of looking at it from that side too, to see how could we make this then go well.
Yes, there's some great suggestions, Heather, going along with that idea of going well. Casey says she would guess that Olivia is not the only child who is not engaged for the entire book. So maybe asking that question of what's been a book that the kids really love. So it's not just about Olivia, but it's building that classroom. Ashley is suggesting having the class do a gross motor activity before sitting down to listen to the story. And Morgan says, I would bring it back to what is developmentally appropriate. Expectations are out of line. So that makes me wonder, why did Ms. Sammy pick that book? I'm curious, maybe she really liked it. Maybe she thinks that's the book she should use. Maybe she doesn't have a framework for that. So finding out what she likes about that, that activity and linking it back to other ones that might have gone a little bit better. And Morgan says, and learning more about following the child's lead, sometimes routines need to shift. You know, absolutely. I think, you know, for teachers, she may feel like I have to accomplish this, and then this happens, and then that happens. We don't know what is her experience and expectation. Does she feel like she has the capacity and permission to switch things up? So finding out about that, where she is in her career and what has been her role in developing class activities could be helpful. And I know these sound like big picture things, but what we're really doing is we're trying to build that teacher's reflective awareness of what she's doing so that she can have some reflective awareness of what Olivia's doing. We really want to take away the feeling of fault. We don't want the teacher to fault Olivia, and we don't want to fault the teacher for where she is in her pathway.
Thanks, Joanna.
Thank you.
So I just wanted to say too, I think it's really important to make sure that you build a good, strong relationship with those early learning teachers, because I will tell you, like, once you do, then it's just so natural to kind of like jump in and like be able to, you know, use the coaching interaction style and model it. Because even I was in that scenario before, like the assistant was reading a book and the lead teacher was off like trying to prepare lunch, and she just looked very frazzled, and she was like, I don't know what to do because all the kids were running. And I was like, do you want me to try? And we just made a natural switch, and she was okay with it. So I asked permission first before I did it. And then I was able to model some things, and then we could reflect. So, you know, just take it one step at a time, because it's never going to happen overnight either. So I just wanted to point that out. But let's quickly talk about for pediatricians, because really what we thought was that pediatricians are just so important, because every child's going to them for their well visit checks, right? So they are there, they're seeing them, and they're able to help provide that support. There was one thing that we added on the pediatrician handout. We added a quote from Walter Gilliam that said, suspension and expulsion are not a child's behavior, but an adult's choice, which was very reflective of what Joanna had said earlier. And I think it's really important to understand what roles that we play. And so we just wanted to kind of highlight some of that for the pediatricians. So we shared some of the statistics again for them, because I think people, they love stats. Like, that's what they want to see. That's what really resonates with them. And it kind of empowers them to do some kind of call for action, right? And so we talked about why pediatricians should address this. You know, why do they play a role? And really, it's because they can help provide families and connect them to those resources that they need, or provide the appropriate referrals if there's other things going on. We don't want any children to be missed. And so it's really important to collaborate closely with pediatricians and make sure that they're not missing that social emotional component as well when they're seeing children and they're making those timely referrals to appropriate resources and services as needed. We share the same information about the impact on the child and the family and the community, because I think it's really important that they understand this, right? And so we gave them that same information as well as strategies. What is it that they can do in their role as pediatricians? So let's quickly look at this last scenario. So now we're visiting pediatricians, right? And how appropriate, because we just ended Early Intervention Awareness Month. So it's Early Intervention Awareness Month. Your team is planning visits to local pediatricians to raise awareness and strengthen partnerships. After noticing an increase in families experiencing suspension and expulsion from early childhood programs, your team decides to focus on this specific issue during your outreach. So what do? So now what is it that you're going to do with this information, right? Yeah, that's right, Beth. Bring this hand out. We basically just gave it to you, right? And so now you have a tool and a resource that you can utilize. So I'm going to show you all of these handouts are now available. And let me just quickly move this over so you can see it on our website. But when you go to our website, so in case nobody has ever been to our website before, if you go over to Early Intervention Topics and Tools and you go to Topics and Trends, we have a whole array of different topics, but we're going to go to Social Emotional Development. And here we have handouts and documents. So we're going to scroll down and you will see the whole package together. So that's going to include the video, each of the handouts for every specific audience. So definitely take your time, check it out, because I'm telling you, it is filled with really good information. And I hope like us just kind of coming together and pulling it together for you all is a good resource that you are able to utilize or have conversations, because really we all have to play a role in eliminating suspension and expulsion. And so every single person here today, thank you for coming, because this is a hard topic, but thank you for coming. And I hope that you'll continue that role that you play. And I'm going to let Lorelai kind of debrief, but if you have questions, go ahead and drop them in chat now. And thank you, Morgan, for dropping some tips for circle time and group reading activities.
Yes, I was just about to share the handouts again. Morgan, thank you so much for sharing the whole. If you scroll up in chat, Morgan just shared all of the handouts together, and then Lisa showed you how to get there on your own if you're just thinking about the handouts and wanting to Google it and wanting to find where to get to them. We really want to thank so sincerely this group of people for all, and Tracy, who is not here with us today, sadly, for not just presenting these 2 sessions and all of the work it went to pull these sessions together, but also for all of the wonderful thought and research and work that went into how to prepare these resources for all of the different stakeholders who play a role in preventing suspension and expulsion for our infants and toddlers. So thank you guys very much. I'm very grateful for the work and for these resources. This is a wonderful way to close out Talks on Tuesday for the spring. We do take a break during the summer, but we will be back in August with registration, sharing a registration link for our September Talks on Tuesday. So keep an eye out for that. And we hope to see you at some other things happening this summer, but for Talks on Tuesday, we'll see you then in September. Please put any questions you have in the chat. We'll look for those, right? Don't forget your certificates. So we need your feedback in your email at this point. You should check your inbox and there should be a survey. You're going to complete that survey, give us all of your wonderful feedback. And then once you complete that, you'll be able to download your certificate to receive your PD hour credit. So thank you.